Hi, I am Dr. Venkatesh. I'm a consultant neonatologist. Today I'm discussing about the ultrasound signs of pneumothorax. A term neonate was born at 38 weeks of gestation. He required resuscitation in the form of intubation. In the NICU, he was connected to the ventilator. 10 minutes after connecting to the ventilator, he deteriorated clinically. His heart rate started to come down. He started desaturating. He became blue. The clinical diagnosis was made pneumothorax. Immediately, the cold light transillumination was performed, which demonstrated the pneumothorax on either side. The nurses were advised to equip themselves for the drainage of the air from the pleura. The X-ray was ordered and the bedside ultrasound was performed to confirm the pneumothorax. So here, when we did the chest ultrasound, we saw the absence of sliding movement of the pleura. We saw the absence of comet tails, and we also could appreciate linear laminar pattern in the tissue superficial to the pleura, and similar pattern, that is linear laminar pattern, deeper to the pleura, which is also called as the barcode sign, which is also called as stratosphere sign. This is actually a sign of pneumothorax when we cut the pleura using the M mode. My friends, the sensitivity and specificity of these signs are great in the diagnosis of the pneumothorax at that interspace. Normally, we all know that in a normal lung, when we do the ultrasound, you will see the bright structure moving horizontally back and forth, demonstrating shimmering appearance of the pleura, bright structure, which is also called as sliding sign of the pleura. Because the sliding of the pleura, you will find the artifact of the pleura appearing as vertical pockets, which are bright in structure. Normally in neonate, you will find around 3 to 4 or 5 vertical pockets at each interspace, called as comet tails. When we do the M mode, that is cutting at the pleural line, one can demonstrate the linear laminar pattern in the tissue superficial to the pleura, and deeper to the pleura you see the sand-like structure. This is called as seashore sign. So, my friends, the back and forth of movement of the pleura, called as the sliding sign, the presence of comet tail, and also demonstrating the seashore sign or sea sand sign on M mode ultrasound, rule out the pneumothorax. So, the bedside ultrasound, the utility of bedside ultrasound is great in the diagnosis of pneumothorax, and every neonatologist should acquire the knowledge of demonstrating the pneumothorax using the bedside ultrasound, because it is an emergency. Because each second is important in the diagnosis of pneumothorax. You cannot rely on the X-ray because it takes a long time. By the time the X-ray technician comes and does a chest X-ray, the time is already gone. Baby, you may not survive the baby. So this is an emergency ultrasound one should acquire, especially when you are dealing with sick neonates on ventilator. Subsequently, after the diagnosis, the chest X-ray also confirmed the diagnosis. Meanwhile, the drainage, the intercostal drainage was performed. You could evacuate the air from the pleura. Immediately, we became all right. Stayed on ventilator for a couple of days, gradually being down to
So much.
CPAP, and then got discharged on full feeds a week after that. Thank you so much.